And with February being Black History Month, Black women have been at the forefront of medical discovery and at times without their consent. As Brett Brooks reports, the state of Illinois has officially declared medical racism an epidemic in the state for Black women who are pregnant. And we do want to warn you that viewer discretion is advised.
In the 1840s, 12 enslaved women were used as experiments by Marion Sims without anesthesia, pain medication, nor their consent. His practices laid the foundation for current practices in the field of obstetrics and gynecology, leading to a crisis for hundreds of Black women, especially during pregnancy and postpartum. And at times, these mainstream practices can be deadly.
I didn't get any information. They just got to moving and working, which is understandable, but I was like, is my baby okay? Is my baby alive? Is he breathing? It wasn't like the butterflies, like, oh my gosh, you know? Because in that moment, I went into like panic mode. I really couldn't even talk. I was just hollering because I didn't know what was happening.
When Alencia Boyce gave birth to her second son in 2021, she says it was pure panic in the seconds her son came into the world.
Yeah.
Is he breathing?
We're gonna get kick-started.
I was previously diagnosed with a high-risk pregnancy. At the 37-week checkup, did the sonogram, and she was like, "Are you ready to have a baby?" I was like, "No." She's like, "Well, go get your bags because your placenta stopped working, so we have to induce you." Once he started coming down the birth canal, he swallowed amniotic fluid, which caused him to stop breathing. So when he came out, they put him on me, and I was like, why is he not crying? And I looked down, and I could see him going from white to dark purple.
Fortunately, her son survived. But for some Black families, complications during delivery can lead to mortality for either the mom or the baby.
We just want justice for our son. They lied to us. They ain't let us touch him.
Just this month, 2 Georgia parents launched a lawsuit against the hospital their son was born in after his death was ruled a homicide due to decapitation during their delivery. This led to a larger discussion. Right here in Illinois, on average, 88 women die a year, either while they're pregnant or within a year after they gave birth, with 91% of these cases preventable. According to the latest study from the Illinois Department of Public Health, Black women are twice as likely to die from pregnancy-related conditions, and the studies show the problem is institutional.
Because we see these factors are things that we can prevent both among white and Black women. But why are Black women dying at 3 times the rate as white women is because we are seeing issues with, are we identifying their problems easier? Are we listening to them? Are there some structural racism issues? Are there some bias issues?
Most medical students will tell you that Black patients still have thicker layers of skin, are more likely to withstand pain, have higher pain thresholds, none of which is true, right? And so this is why the discipline of obstetrics and gynecology is very problematic for Black women navigating healthcare, because you're coming into a racist healthcare system that was founded by racist ideologies, racist practitioners. You're being trained by people, clinicians who have been exposed to racism in their medical education, and you're dealing with a system that is ultimately not designed to center or prioritize your needs as a Black pregnant person.
In Springfield, legislative work is being done right now to address racism as its own crisis. Lawmakers introduced Healthy Illinois 2028 to improve health equity for Illinois residents, with an emphasis of race at the forefront.
We've also created racism and sort of labeled racism as a public health crisis to be another priority of that plan. Because we know that if we want to address these disparities, we got to get to the root of these issues and really try to create the solutions, operational community solutions that allow us to achieve our goals of health equity.
With these goals and objectives in place, health experts say Black women like Boyce will soon be able to enjoy their transition to motherhood without the worry on the delivery table. As she enjoys these moments with her now 2-year-old son, She hopes her story will encourage more women to speak up, ask questions, and advocate for themselves.
How's he doing now? He's fine. He's very smart, very outgoing. His rough start didn't really impact him developmentally, but he is sensitive to stress. And I figured out later on, after speaking with different people, because of how he was born, he's very sensitive to stress.
One solution all the doctors agreed on was to allow the expectant mother the option to have an advocate at her side throughout the entirety of her pregnancy and in the months to follow. In our next part, we are going to look at how doulas have helped dramatically change the mortality rate and provided better outcomes for mothers. More on that Tuesday on WEEK at noon.